Great. All right. So today, I'm going to be talking about spironolactone. And the objectives for this presentation are that students will be able to state the mechanism of action by spironolactone in the body by the end of this presentation. Students will be able to state the labs to monitor and which medications interact with spironolactone by the end of the presentation, and students will be able to identify disease processes that commonly use spironolactone and how it affects the diseases by the end of this presentation. Fast facts: the drug class, it's a potassium-sparing diuretic. Efficacy and safety, it's been deemed safe and effective for management of CHF, acne, hypertension, and many others. It can also be called a water pill. It was first utilized in 1959. It's on the World Health Organization's list of essential medications. It can safely be utilized in all age groups, and it's a very economical treatment modality. The mechanism of action is that it's an aldosterone antagonist. It works on the distal convoluted renal tubule, binds to the cytoplasmic mineralocorticoid receptors, and competitively binds to aldosterone receptors where potassium and sodium exchange. This creates diuresis while sparing potassium. This gives it a diuretic and antihypertensive properties. Because it competes at the aldosterone receptor site, it allows for decrease in conditions that involve hyperaldosteronism. Labs that you need to monitor for any patient that's on spironolactone are serum potassium. Due to the fact that it's potassium sparing, individuals can have increased potassium levels, especially if they're on potassium supplements or potassium or other herbal supplements, which can increase potassium. You also need to measure the patient's serum creatinine to ensure the patient doesn't have renal issues due to the diuresis of spironolactone. Drug interactions, again, hyperkalemia, potassium supplements will increase the potassium levels. And since it's a potassium sparing diuretic, it can also help save potassium in the body, thus increasing potassium levels. It also increases the concentration of the following medications: digoxin, ACE inhibitors, angiotensin II receptor antagonists, trimethoprim, which is associated like Bactrim, nitrofurantoin, which is commonly used for urinary tract infections, your cyclosporins, tacrolimus, and your low molecular weight heparin. Most common side effects are drowsiness, dizziness, lightheadedness, stomach upset, diarrhea, nausea, and vomiting. It's important when you put a patient on spironolactone to ensure that you tell them to move slowly when they go to get up so that they don't get orthostatic hypotension and pass out. Serious side effects that you should stop using spironolactone for are muscle weakness, pain or cramps, pain, burning, numbness, or tingling in the hands or feet, inability to move arms or legs, changes in heartbeat, confusion, or extreme tiredness. Diseases that are treated: skin complaints, acne vulgaris, hidradenitis suppurativa, hair complaints, female pattern baldness, hirsutism, heart failure, ascites and peripheral edema associated with portal hypertension and hyperaldosteronism, things like cirrhosis, hepatocellular cancer, extensive hepatic metastases, nephrotic syndrome, hypertension, and primary hyperaldosteronism. The expected course of treatment for acne vulgaris is fewer new outbreaks. For hidradenitis suppurativa, it's a decrease in lesions. For female pattern baldness, it's suppression of the androgens, improved hair loss. Hirsutism, it decreases hair growth. Heart failure, it produces improved diuresis and thus decreased edema. The ascites and peripheral edema associated with portal hypertension and hyperaldosteronism produces decreased edema. Nephrotic syndrome, there's an improvement of fluid retention because of the diuresis. Hypertension, there's improvement due to diuresis. And then primary hyperaldosteronism, improvement of fluid retention related to increased aldosterone. The latest research shows increased effectiveness and utilization in heart failure to preserve functioning, adding spironolactone to things such as Lasix. Increased utilization of spironolactone can have anti-inflammatory properties and help patients have less overall inflammation. The other research has shown it may not have as much effect on acne vulgaris as previously stated, and you may need additional treatments. It's also especially useful in patients with PCOS to decrease overall inflammation and the hirsutism. So the learning environment that I would present this in is classroom and or virtual learning for undergraduate nursing students enrolled in a pharmacology class. They're in a professional environment and have met the necessary minimum requirements for the course. In addition, the next how I would know that they learned something is that they'll correctly answer the quiz questions at the end of the presentation. One of the quiz questions is, which of the following is not involved in the mechanism of action for the medication spironolactone? And A, works on the distal convoluted renal tubule, B, binds to cytoplasmic mineralocorticoid receptors, or C, competitively binds to aldosterone receptors or potassium and sodium exchange. D, this creates diuresis without sparing potassium. And obviously the correct answer in this is D, it spares potassium, so that's incorrect. True or false, it is important to monitor serum creatinine, serum potassium, and serum sodium in a patient taking spironolactone. This is false. The only things you need to monitor are serum creatinine and serum potassium. Sodium does not need to be monitored. Question 3, spironolactone increases the concentration of which of the following medications? A, digoxin, B, ACE inhibitors, C, angiotensin 2 receptor antagonist, or D, trimethoprim, or E, all of the above. The correct answer is E, all of the above. Spironolactone is not utilized for which of the following disease processes? A, hirsutism, B, congestive heart failure, C, hypotension, D, nephrotic syndrome. Obviously, it's C, hypotension, because it's used for hypertension. And then according to the latest research, spironolactone is least effective for which of the following disease processes? A, heart failure, B, acne vulgaris, C, polycystic ovarian syndrome, or D, hypertension. The answer to that one is B, acne vulgaris, as it's fallen out of favor. And then linked to objectives. So all the objectives, the one about being able to identify the mechanism of action was met through the PowerPoint presentation evaluated by the quiz question. All 3 objectives were met through PowerPoint presentation and thus evaluated by the quiz question. Any questions?